Good afternoon, everyone, and thank you so very much for joining us for our meet and greet. This is the fourth of our 4 sessions, and we're so excited to have you with us. I'm Linda Gargan, for those of you who I have not met previously, and I am the Executive Director for the National Federation of Families. I also serve as the PI for the National Family Support Technical Assistance Center, which we're all here to learn more about. We are hoping that the next 30 minutes will give you a great overview of our plans for the Technical Assistance Center. And you're going to have the opportunity to meet our staff and our wonderful partners. But first, let me tell you just a little bit about the National Federation. We are a national advocacy organization that supports families whose children experience mental health and/or substance use challenges. We have approximately 120 chapters across the nation that support these families on a daily basis, and they advocate for family voice in their communities. I would invite you to learn more about the Federation if you're unfamiliar by visiting our website for more information. This year, we were very excited that the National Federation was awarded SAMHSA's first Family Support Technical Assistance Center. The Technical Assistance Center has partnered with 4 amazing organizations to do this work. And you're going to be learning more about these organizations in the next few minutes. Now, as we're describing our work, it's important that you understand not only are our partners experts in their fields, but we had as the heart of our proposal to bring together individuals with lived experience. So as we introduce our partners, we want to emphasize that our staff and our partners for the Technical Assistance Center are comprised of individuals who share a common trait of lived experience, either as family members or as individuals in their own recovery. And we want to invite you to be interactive in this meeting by utilizing the chat box to introduce yourself, ask questions, give feedback. But please know that as we go through this, you'll hear about other feedback opportunities that we're going to ask you to please take advantage of. So for now, it's my pleasure to introduce you to our project director for the Technical Assistance Center, Gail Cormier. Gail has joined us from North Carolina, and I am going to turn this over to her and let her tell you much more about our Technical Assistance Center.
Thank you, Linda. And hello, everybody, and Happy New Year. As Linda said, I am Gail Cormier. I'm the director of the National Family Support Technical Assistance Center. I'm also the mother of 3 adult daughters, all who have experienced mental health challenges in the past, and they still do. And at times, our family has been stressed because of this. In addition to being a parent, for the last 14 years, I was the CEO or the executive director of the state family-run organization. And prior to that, I was the ED of a provider agency for transition-age youth at risk. I've had vast experiences on all sides of the table. So today, we're going to talk about who the National Family Support Technical Assistance Center will serve. We will serve families whose children experience mental health and substance use challenges across the lifespan by providing technical assistance and training to the workforce, organizations, and communities that support them. Whenever possible, we will make sure that trainings, webinars, learning communities of practice will be facilitated using a collaborative approach of family and provider experts. As parents, we know parenting does not end when our children become adults. I know for a fact when that phone rings and I see it's one of my daughters on the other end, my heart skips a beat. And that is why the National Family Support Technical Assistance Center plans on providing technical assistance to the workforce that supports families through the lifespan. This overall goal for the Family Support Technical Assistance Center will be to provide innovative, flexible, and responsive training and technical assistance. Our intent is to inform the workforce directly serving families and their loved ones in both the mental health and substance use systems, including educators and other professionals who are engaged with caregivers regarding the importance of including family support in treatment planning and implementation. We will also strive to increase access to comprehensive best practice resources that address the epidemiology, genetics, cause of illness, course of illness, treatment and recovery services for major mental and substance use disorders for families and support professionals. To provide best practice trainings for healthcare professionals regarding family engagement and family support. And of course, to provide training that increases knowledge about the needs of families and their children at any age, as well as evidence-based and promising practices such as family peer specialists to the community at large, including policymakers. Because there are 39 technology transfer centers and technical assistance centers, 39, the National Family Support Technical Assistance Center is currently conducting a situational assessment. We want to learn where our commonalities align and how, if possible, we can work together on technical assistance projects. One thing is for certain, most populations served have families, and the National Family Support Technical Assistance Center is the family center of excellence. We'll provide information, training, resources, workforce development, technical assistance. These types of trainings listed are just examples of what we could provide. And of course, I can't do this alone. You've met Linda Gargan, our principal investigator. Now I'd like to introduce you to Michelle Covington, our project manager, and Kelsey Engelbrecht, our communication and media manager. Both Kelsey and Michelle make up our internal staff, and I really want to shout out to Kelsey for making today's meetings go so smoothly. Not only do we have a great internal team at the National Family Support Technical Assistance Center, we have a strong, experienced external partners and an advisory board comprised of national individuals with lived experience. All of us value lived experience. This lived experience combined with our collective decades of professional experience as researchers, practitioners, training and technical assistance providers, and leaders in the family support and recovery areas. This experience informs every aspect of our work. Our partners have a rich history of developing family-friendly resources for those experiencing behavioral health and substance use disorders, including co-occurring mental health and addiction disorders. Family run. As Linda shared, the National Family Support Technical Assistance Center is led by the National Federation of Families, a family-run organization, in collaboration with our partners, the Partnership to End Addiction, C4 Innovation, SAFE Project, and Boston University. So at this point, I am very excited for you to meet our external partners. First is the Partnership to End Addiction, and I'd like to call Alex Mclean to talk about the partnership.
Thanks, Gail. Hello, everyone. My name is Alex Mclean, and I work for Partnership to End Addiction. As Gail said, I work with Fred Munch, Aaron Hogue, and Doug Liu, and we're all very excited to be a part of this new National Family Support TAC. And today I'm just going to share a little bit about what our organization does. So Partnership to End Addiction is the nation's leading organization dedicated to addiction prevention, treatment, and recovery. We're committed to supporting the whole family by addressing every aspect of substance use and addiction. Our mission is to help the helpers using a public health approach rooted in both science and compassion, transforming how our nation addresses addiction by empowering families, advancing effective care, shaping public policy, and changing culture. We provide personalized support and resources directly to family members impacted by addiction, while mobilizing policymakers, researchers, and healthcare professionals to more effectively address addiction on a national scale. We also partner with organizations and corporations across public and private sectors on the local, state, and national level to advance our mission and work for families. As a partner, we hope to contribute to this TAC in a few different ways. At the partnership, we have built a suite of family support services that aim to empower families with information, support, and guidance to help their loved ones prevent and overcome substance use. Through these services, we primarily work with parents and concerned significant others because we know that the presence of a caring and empowered adult in a young person's life is associated with improved addiction prevention and intervention outcomes. As part of these services, we have a national helpline operated by trained specialists who provide support to parents, other family members, and friends who have a loved one struggling with substance use. And this helpline can be accessed through digital platforms like text messaging, email, or Facebook Messenger, or also as a scheduled phone call. Parent coaching is another program where family members can be paired with a peer coach and are offered 5 to 6 one-hour weekly phone calls with their coach. And these parent coaches are trained peer volunteers who have been personally affected by a loved one's substance use and are now prepared to share their experience and counsel with other families. Help and Hope Texting is a free text messaging service for affected family members that delivers evidence-based skills, personalized guidance, and support. We also have an online support community with free online group meetings, offering family members an opportunity to connect with others who are going through a similar situation. And then lastly, we have a large library of addiction-focused digital resources available for family members to reference, and this includes things like ebooks, guides, articles, videos, blogs. And just to provide a scope of these services, in 2020, we supported over 15,000 families across all of these services that I just mentioned. So in addition to these family services, we also operate a clinical training academy that delivers training to practitioners who serve families affected by substance use and related behavioral problems. Our training content here focuses on increasing provider use of evidence-based practices to increase family involvement in treatment, enhance family relational and coping skills, and facilitate family education and decision-making about medication use. And these trainings can be tailored to just about anyone, to the needs of behavioral health clinicians, physicians and other medical staff, home visiting and wraparound workers, school counselors, paraprofessionals, peer supports, and other providers. And last but not least, Partnership System Improvement Institute collaborates with funders, regulators, policymakers, and clinical experts to provide the latest evidence-based knowledge and tools to inform transformation of organizational practices. And the technical assistance targets here include program administration support, regulatory and billing assistance, fiscal sustainability planning, and best practices in clinical assessment and care. Thank you.
Thank you, Alex. Next, Justine Henson will speak about C4 Innovations.
Hello and good afternoon, everyone. My name is Justine Henson, and I'm part of the C4 Innovations National Family Support Technical Assistance Center team. And we are all very, very excited to be part of this collaboration and this incredible team that the National Federation has assembled. C4 Innovations is a recovery-focused small business with extensive experience delivering training and technical assistance for SAMHSA and other federal agencies. You may know us from our work leading the Bringing Recovery Supports to Scale Technical Assistance Center strategy for SAMHSA, providing recovery technical assistance for the Opioid Response Network, or for our work on the New England Mental Health Technology Transfer Center, SPARS, or any other national or state technical assistance center initiative. We are deeply committed and passionate about helping individuals, agencies, and communities build their capacity to deepen the impact of their work. One of our core values at C4 Innovations is the integration of people with lived experience of mental health or substance use recovery in all of our work. Many of our staff identify as having lived experiences of recovery, and many more of us also identify as family members of loved ones with substance use disorder, mental illness, or both, including myself. In addition, our staff brings decades of experience, really multidisciplinary experience across the board as direct care staff, peer support workers, researchers, clinicians, evaluators, supervisors, and administrators. And we know that when people are able to access quality treatment and recovery support services for themselves and their family members and participate fully in how services are delivered, the outcomes are better and individuals and communities are healthier, and systems, communities, and organizations are more efficient, equitable, and inclusive. As in our role as part of the National Family Support TA Center, we will be leading the evaluation for this project, as well as contributing to the situational assessment, the needs assessment, and providing technical assistance. The evaluation will be led by our Director of Research and Evaluation, Kathleen Ferreira, who is pictured here. In addition to her incredible expertise in research and evaluation, Kathleen is an expert in children's mental health, family engagement, and advocacy. In addition, our team also includes Livia Davis, Valerie Gold, Vanessa Ronsky, and myself, and we will be contributing to a needs assessment to inform the development of training and TA to ensure that it really reflects all of your needs, all the needs of folks in the field, and we're really excited to be engaging with you all to learn more about your needs further ahead in this project. And we'll also be helping to develop a range of technical assistance opportunities. So thank you all so much for being here, for showing interest in this new initiative, and we are incredibly excited to be part of this work to support families. Thank you.
Thank you, Justine. Next, I want to welcome Bill Pinamont for Safe Project.
Thank you, Gail. Hi, Bill Pinamont here. I work with Brandy at Safe Project. If Safe Project is new to you, it is a nonprofit that was founded in 2017 by the former Vice Chairman of the Joint Chiefs of Staff, retired Admiral Sandy Winnefeld, and his partner, Mary, after the accidental overdose of their son, Jonathan, during his first week of college. The mission is to raise awareness and provide support for folks facing substance dependence and mental health challenges. Check out our website to see the good work we are doing on campuses, in communities, at workplaces, and with veterans. In 2019, the organization added Safe Veterans specifically to support military-connected folks. As you might imagine, helping military families is very close to the hearts of Sandy and Mary because of their 37 years of service to our country and the challenges they faced. I joined SAFE to lead these programs last year. I am a Navy veteran and I served for 25 years. I retired from the military in 2014. I am a lawyer social worker. I have been married for 33 years and have 2 adult children. My family experienced military stressors and worked through many challenges during my years of service. For the past 5 years, I've been working directly with military-connected folks to help them overcome challenges and realize the strengths they gained from the military experience. I'm excited to be a member of the National Family Support Technical Team, and I look forward to providing assistance to active duty, veterans, families, caregivers, spouses, children, by providing education, guidance, and support so that they can more effectively assist their loved ones relative to their own unique needs within their family dynamic. I hope also to assist providers so that they can better understand the military culture to further support family engagement as appropriate in treatment planning and implementation, as well as an understanding of the lifelong process of recovery. Thank you, and it's very nice to meet you all.
Thank you, Bill. And next from Boston University is Marianne Farkas. Marianne, you're on mute.
There. I apologize. Clicking on too many buttons at once. My name is Marianne Farkas, and I'm the Director of Training and Technical Assistance at the Center for Psychiatric Rehabilitation at Boston University. It's an honor to be involved in the National Family Support Technical Assistance Center and to work with all the wonderful partners that you've heard about this afternoon. As a family member myself with several relatives from college age to senior citizens, all living with mental health challenges. I am excited that this new TAC is being designed to help support families such as my own throughout the lifespan. Over the past, 40 years, our center at Boston University has been working with adults with serious behavioral health considerations and their support networks. We are a research, training, and services center with multidisciplinary staff, of whom approximately 30 to 45% at any given time are individuals with lived experience of mental health conditions and their families. Our research division focuses on investigating areas related to employment, for example, developing interventions such as thinking skills for work, illness management and recovery for work, etc., as well as other domains of recovery-oriented practice to develop a new evidence base for the field. Our services division specializes in innovative models. For example, we pioneered the concept of supported education in the early 1980s. Currently in the services division, we have developed and tested service innovations with respect to supporting college students on medical leave or those wishing to return to college, for example. We've created a service program model which uses an adult education approach, or the recovery education program for adults. Lastly, we have a knowledge translation division, which I lead. We deliver academic and in-service training and technical assistance, both in person and online, designed for professionals of all disciplines, family members, people in mental health recovery, and other stakeholders. We also focus on synthesizing and embedding new research findings to create tools and supports that are easily used by a range of stakeholders. For example, we created an online toolkit for providers to develop recovery promoting competencies when supporting people in mental health recovery. We've developed products, particularly with respect to recovery support and psychiatric rehabilitation, that translates empirical evidence into usable information disseminated through training and implementation science nationally and internationally in over 30 countries. With respect to families, we've trained families, for example, on how to work with professionals, as well as trained professionals in how to support families. We've created family guides, information repositories to assist families supporting their loved ones in getting and keeping meaningful work. In terms of the specifics of what we're doing on the TAC initiative, we will be providing resources, for example, to contribute to the virtual library that is being developed, acting as subject matter experts for webinars and other TAC activities as they arise, with materials that are both recent and relevant. The project that we will specifically lead will be to help professional disciplines include knowledge and expertise relevant to families in their credentialing process, as a way of ensuring that we graduate professionals who are knowledgeable and skilled in supporting families as families wish to be supported. The Center for Psychiatric Rehabilitation at Boston University is excited to have this opportunity, and we look forward to working with all of you over the coming years to ensure that families have the tools and supports they need to help their relatives look forward to their future and lead the meaningful lives they want. Thank you.
Thank you, Marianne. So who could benefit from the Technical Assistance Center? Recovery support organizations, family support and family-run organizations, educators and school workforce, providers, clinicians providing family support, family peer specialist workforce, community members and organizations. We really want to reach out to educators and the community at large, including the faith community. And as some of you may know, I am dedicated in supporting and expanding the family peer specialist workforce. So what's next? We will be conducting a needs assessment that will include a survey and a listening session. After today's call, you will receive a survey link for you to give your input as to what you would like to see from the National Family Support Technical Assistance Center. The survey's front page will look like this. Now, I know I'm sure you're getting a lot of surveys to fill out. I'm just going to ask if you please fill one more out, and that is for us. It is critical to our work and to our ability to support families and their children across the lifespan. Some examples of technical assistance could mean your organization could access webinars designed to build family workforce, how to work with the state Medicaid office and managed care organizations to fund the expand the family support workforce, an online resource library that would host tools and resources that provide ideas on a family engagement, self-paced trainings, peer learning communities, as well as communities of practice, and specialized toolkits, for example, on board development. Other ideas could be tip sheets, how-to videos, and possibly chat communities. So coming soon. Along with the surveys, we'll be hosting listening sessions to help inform our needs assessment for technical assistance. A listening session is a facilitated discussion with a small group of people aimed at collecting information about their experience and needs for technical assistance, much like a focus group. I know, as the former executive director, I've had some wonderful technical assistance, and sometimes it just did not make the mark, that something was missing, and I needed more. That's why we want to know what you want in technical assistance and what you need. I thank you for your time today, and I want to remind you to look for that survey link that will be emailed to you. And if you have any questions, there's my email. Please feel free to email me and fill out that survey. Thank you very much. Bye-bye.